is Chloe. I'm going to be your nurse today. Can you tell me your name and date of birth?
Miles Miller, 08/20/2002.
Okay. And can you tell me any medical diagnoses that you have?
I have a hiatal hernia, pars defect, and anxiety.
Okay. And do you take any medications daily?
Protonics.
Okay. Do you have any allergies to medication?
Mm-mm.
Okay. Do you have any seasonal allergies?
Pollen.
Okay. So, I'm just looking. Have you traveled outside the U.S. recently?
No.
Okay. And are you up to date on all your vaccines? Have you gotten a flu shot?
No.
Okay. All right. So, we're just going to get started with the head-to-toe assessment. So, to begin, I'm going to inspect your head. Look up for me. I'm going to inspect your head. Okay. Now, I'm just going to palpate your scalp and cranium. Okay. All right, are you having any tenderness or anything with your head? Okay. So, looking at you, you're very symmetrical. Everything's good and aligned. So, now I'm going to look at your jaw. Can you open and close your jaw? Okay, now open it. Okay. So, that was testing cranial nerve number 5. So now I'm going to take a cotton ball. Close your eyes for me. I'm going to see if you can you feel this?
Yep. Yep.
Okay. So now I need you to, I'm going to be testing cranial nerve number 7. Can you smile? Frown? Puff out your cheeks? Okay. So that was all good. Now I'm going to get you to read that sign that's over there. It's just letters. Can you read it?
Yep.
Say it out loud.
RASWT.
Okay, good. So that was for cranial nerve number 2. So now I'm just going to get you, we're going to be testing cranial nerves 3, 4, and 6. So I'm going to get you to follow this pin, okay, with your eyes only. Okay, good job. Okay. Now, I'm going to look at your pupils with this pen light. Okay. So, they do have perla. Okay. So, now I'm going to be performing a whisper test. So, I'm going to cover one side of your ear. I'm going to whisper in the other, and you're going to tell me what I whispered. What did I say?
That's not a clue.
Oh,
Grape.
okay.
Peach.
Okay, good job. So, now I'm just going to look at your eyes, and I'm going to look at the sclera and conjunctiva, and your sclera is white and your conjunctiva is pink. So now I'm going to look at your nose. So can you look at me straight on? Okay, it's symmetrical. Do you have any pain or tenderness? Okay, so now I'm just going to look in your nares. Okay, now can you cover one nostril and sniff? Now do the other. Okay, so one of them's patent, one of them's a little stuffy. So now I'm just going to feel your sinuses. I'm going to feel your frontal sinuses. Any pain or tenderness?
No.
Okay, any pain or
No.
tenderness? So he did have his tonsils removed in an adenoidectomy. Okay, so now I'm going to take the pen light and I'm going to look in your mouth, okay? So like I said, he does not have tonsils, so I cannot grade his tonsils. Okay, say ah. Okay, so now I'm going to test your gag reflex. Okay, he does have a gag. So now what I want you to do is stick out your tongue. Okay, it is symmetrical. Now move it side to side. Okay, good job. So now I'm going to be looking at your neck. Okay, everything's symmetrical. I'm going to be palpating your lymph nodes. Okay, now look up for me. Okay, the trachea is symmetrical and your thyroids are not palpable. Okay, so now I'm going to get you to look side to side for me, chin to chest, and neck back. Okay, good job. So now I'm just going to be feeling your carotid pulse. Okay. Now I'll be listening for any bruise with the bell of my stethoscope. Okay, and then the diaphragm. Okay, so you have no bruise, which is a good sign. Okay, now what I want you to do is stand up for me. Okay, you're going to turn. Okay, now take a deep breath. Okay, now turn. Take a deep breath. So his breathing is symmetrical. He doesn't display any respiratory distress when he breathes. So now you can sit back down. Okay, so now I'm going to palpate, I'm going to palpate the posterior lungs. Okay, so I don't feel anything abnormal. So now I'm gonna be feeling for any flank pain. If you have pain, this would indicate some kidney problems. You have any pain? Okay, so now I'm gonna auscultate your lung sounds. Turn around, please. Okay, take deep breaths for me. Deep breath. Deep breath. Deep breath. Okay, so lungs are clear and equal bilaterally. No crackles or rhonchi or anything like that. So now, can you put out your arms? Okay, I'm just inspect your arms. Okay, and I'm gonna palpate. Is there any tenderness? Okay, so now I'm gonna test your reflexes. So I need you to do like this. Okay, relax. There we go. Okay, now this one. Okay, so now I'm gonna test this one. Oh my God. Okay, so his reflexes are 2+, which is normal. Okay, so now I'm gonna just feel your brachial pulse. Okay, 2+, which is normal. Okay, now I'm gonna feel your radial pulse. 2+, which is normal. Now your ulnar pulse. Okay. Okay, and 2+. So everything's normal with your pulses. So now I'm going to test your capillary refill to make sure it's less than 3 seconds, which it is. Okay, good job. Now I'm gonna test the range of motion for your shoulders. So I need you to stand up. Shrug your shoulders. Okay. Put your arms up like this. Okay. Like this. Okay. Try to lift your arms. Okay. Now try to go down. Okay. So now I'm gonna get you to do like this with your elbows. Sorry. And get back down. Okay. So try to lift them. Okay. Now go down. Okay. Go down. Okay, good job. So now do like this with your wrists. Go in a circle. Okay, go up, hyperextend. Okay, and down. Okay. Now push against me. Okay. Now push against me. Okay, good job. So now I'm going to get you to put your finger to your nose. Do that again. Finger to nose. Okay, good job. Okay, so now I'm going to place something in your hand and you're going to identify what it is. Okay, close your eyes. I'm going to place this in your hand. Can you tell me what it is by feeling it?
Is it in there? It's a Q-tip.
Okay, good job. So now I'm gonna write something on you. Can you tell me what I draw?
A circle.
Yes, good job. Okay, so now I'm gonna inspect your anterior of your chest. Okay, can you breathe in for me? Okay, so now I'm looking at your pericardium. So now I'm just gonna be palpating. Okay, good job. So now I'm going to be listening to your heart sounds. I'm going to be listening with my diaphragm first. Okay. I'm going to be listening to your mitral for 1 minute. Okay. So your heart rate was 86. Okay. Now I'm going to be listening with the bell. I'm sorry. So I'm listening to your atria, your pulmonic, your Erb's point, and your tricuspid, and your mitral. I'm also going to be listening to this for 1 minute. I'm gonna get you to lay down so I can listen and inspect your abdomen. On the floor? No, on the couch. Okay, can you scoot up for me, please? Okay, so first I'm gonna inspect your abdomen. And so you have a hiatal hernia. Can you point to me where it is, where it's located? Okay, so he's pointing to his left upper abdomen. Okay, this is not a good representation. I'm so sorry. Okay, so I've already inspected. Now I'm gonna auscultate next. So I'm gonna auscultate all 4 regions, and then I'm gonna auscultate your aortic artery and then your renal arteries. Okay, so your bowel sounds are normal active. So now I'm gonna auscultate your aortic artery and your renal arteries. Okay. So now I'm gonna palpate your liver to check for any, if I can feel it. And I cannot. Okay. So now I'm going to be examining your lower extremities. You can stay lying down. So I'm going to be feeling your popliteal. Here's a pillow. Okay. I'm going to be feeling your popliteal pulses, your dorsalis pedis pulses, and then fetal pulses. Okay, so I'm going to be feeling your popliteal pulses first. Okay. Okay, they are 2+ bilaterally. Now I'm going to be feeling the dorsalis pedis pulses. Okay. And then the pedis. Okay. So all of his pulses were 2+. So now, what I'm going to get you to do is flex your knee up. Okay, now can you move your leg up? Okay, good job. Now do the same with that one. Okay, now I want you to do the same thing with your ankles. Flex them and then extend them. Okay, now roll. Can you roll them? Okay, good job. Now, what I'm going to get you to do is stand up for me, please, and sit in the chair. And I'm going to test your reflexes. Okay, so dangle your feet, please. Okay. Okay. Okay, so 2+ reflexes. Now I'm going to do the same thing for your feet. Okay. Okay, so we left off on doing your reflexes for your ankles, and they were 2+. So now what I'm going to get you to do is stand up and walk on your heels. Okay, now go back. Okay, now walk on your toes. Okay, good job. So now what I want you to do is hop on one foot. Okay, now hop on the other. Okay, now what I'm gonna get you to do is stay still. I'm checking for balance, swaying. Okay, and you don't have any of that. So now what I'm gonna get you to do is close your eyes. So he does have a little bit of swaying. So that was the Romberg test. Now touch your toes. And I'm gonna inspect the spine, make sure that it's straight. Inspect and palpate, and it is straight. Now what I want you to do is lean side to side, okay, and back and forward. Okay, good job. And that concludes my assessment.